Patients leaving the OAB treatment pathway, interest is shown in emerging wearable neuromodulation systems. This work was sponsored by Ovation Medical. The recommended treatment algorithm for patients seeking relief from OAB symptoms begins with first-line therapy, which is behavioral modification and physical therapy. This is typically followed by second-line therapy medications, and then third-line therapy, botulinum injections, PTNS, or SNS. Due to the comorbidities, side effects, and or expense of OAB medications, most patients never advance beyond second-line therapy and end up either moving back to first-line therapy or opting out of the treatment pathway altogether. This study was designed to understand why patients who begin OAB therapy do not advance along the treatment pathway. In addition, we examined strength of interest for two emerging concepts: wearable neuromodulation systems and implantable tibial nerve devices. Respondents diagnosed with OAB and who had tried first-line therapy to help control their symptoms were asked to complete an online survey to understand their awareness, trial, and satisfaction with currently available OAB treatment options. The respondents were asked if they were aware of second and third line therapies. If they had tried these therapies, respondents were asked about their satisfaction with them and if they were still using the therapies. If they were aware but did not try a particular therapy, they were asked for the reason why. Finally, after reading a brief description, respondents were asked about their likelihood to trial not only the existing third-line therapies, but also two emerging neuromodulation concepts. A total of 132 respondents were included in this summary. At the time of the survey, most of the respondents were treating their OAB symptoms by first-line therapy only, so 39% of them. That was followed by a group that was doing no therapy, so 34%. So all in all, that was 73% were either doing first-line or no therapy at all. 24% of the individuals were using second-line therapy or medications to control their symptoms, and then 3%, a very small number of them, were using third line. We are going to look at the no therapy group and the first line therapy group to try to understand them a little bit more. So there were 45 respondents who were not on any type of therapy. Of those 45 respondents, 19 of them had tried medications to control their OAB symptoms, and less than half of them, or 42%, said they were satisfied with the medications. For those who had not tried second-line therapies, 26 of them, they were asked why not. The main reasons given were the risk of side effects, medications not recommended by their doctor, and a general dislike for medications. For the 51 respondents on first-line therapy only to control their OAB symptoms, 39% had tried second-line therapies, and they were even less satisfied with medications. Only 25% were satisfied with these medications. Of those who had not tried medications to control their OAB symptoms, the main reasons why were risk of side effects, medications not recommended by their doctor, and the expense of those medications. When provided a description of third-line therapies and asked if they were likely to trial these therapies, PTNS had the highest potential trial rate. It was 26% for those who were in the no therapy group and 37% for those in the first-line therapy group. So overall, it was less than a third, if you combine those groups, less than a third of them that were willing to trial PTNS. Those numbers dropped when you looked at botulinum injection and SNS. When groups were provided descriptions of two emerging therapies for OAB, a wearable neuromodulation system and an implanted tibial nerve stimulation device. Both preferred the wearable concept over the implanted tibial nerve device. Furthermore, the wearable likelihood to trial was far greater than the third-line treatments. Patients with OAB have limited options for the relief of their symptoms. Existing second and third-line therapies have significant drawbacks. Many patients who enter the treatment pathway often end up using less effective therapies or do nothing. The result of the study indicates that the patients are reluctant to try other therapies and instead choose to live with their symptoms. So this is waking up at night, frequent visits to the bathroom, these erratic urinary urges, as well as, in some cases, incontinence. Patients indicated that the concept of a non-surgical, drug-free, wearable tibial neuromodulation system was the most preferred option. Thank you.